Hi, my name is Aaron Steele, and today I'm going to be talking about the rare condition known as alien hand syndrome. So, alien hand syndrome is the movement of limbs without conscious control over that movement. There's three types of behaviors associated with the disorder. They're involuntary grasping, self-oppositional activity, and unintended posturing. So examples of involuntary grasping are the grabbing of a glass from a table, opening a drawer when you see it. Self-oppositional activity is anything that has to do with the affected hand performing behaviors that go against the intent of the other hand. So those include closing a drawer when the other hand's trying to open it, or vice versa, or choking your own self even though you're trying to restrain it with the other hand. You could also be reaching for your phone and the other hand fights it, trying to get to it first, or the affected hand could be unbuttoning your own shirt. Unintended posturing has to do with just raising one's hand in the air or making symbols or signs with your hand, things that aren't necessarily purposeful, but they're unintentional and uncontrolled. So at this point, we're going to move into the neurological basis for the disorder, but in order to do that, we first have to understand how intentional movement works. So intentional movement of the limbs begins by funneling information to the frontal lobe from the other areas of the brain. For example, the parietal lobe gives an understanding of the position of our limbs as well as any other signals our limbs are sending. Are they in pain? Are they hot, cold? Are they in a strange position that appears unnatural? All of these messages are encoded in the parietal lobe and sent to the prefrontal cortex. The same thing happens with sights and sounds, but not just the sensations themselves. Those regions send signals about our perception and our memories, allowing us to make decisions based on prior knowledge, not just what the body is sensing. So once all of these messages reach the prefrontal cortex, it quickly scrambles to make a decision: move or don't move, speak or don't speak. Whichever it decides, that message will get sent to the premotor cortex through the through the premotor and supplementary cortex to the primary motor cortex. And then from there, the efferent signals are sent downwards through the spinal column. They actually decussate, they cross over in between the pons and the cervical level of the spinal cord. The limb movement from those efferent signals then sends new afferent signals up through the brain, telling the somatosensory system, the cortex, what's the new position of my limbs? How did they just move? So that process allows us it's a continual process allowing us to control our limbs fluidly. So from here, now that we understand intentional movement, we're going to move on to the three main components of the alien hand disorder, which are the disconnection of control mechanisms, the loss of inhibitions, and some sort of injury or intentional separation that results in hemispheric disconnection. So the first component that we're going to talk about refers to the incongruence of afferent signals received from the moving limbs and what the brain anticipates those afferent signals would be. So essentially, the anterior frontomedial cortex copies the signal being sent to the limb and sends it to the somatosensory cortex. When the somatosensory cortex receives afferent signals from the limb, it attempts to pair that signal with the efferent copy produced by the AFMC. When there's an incongruence, the brain recognizes the movement, but it doesn't interpret it as self-generated. Let's look at a couple examples. In this situation, we have normal activation. So as discussed before, the brain funnels sensations and perceptions into the prefrontal cortex to make a decision on how we behave. Once a decision is made, two things happen. The black line here represents the motor pathway, which is about to send an efferent signal from the motor cortex to the hand. The red line here represents it's coming from the AFMC, and as previously discussed, it makes that efferent copy and sends it to the parietal lobe to tell the brain what to expect from the limb. So the primary motor cortex then sends the signal to the hand, activating muscles to contract or loosen. Whichever movement happens, new afferent signals travel to the parietal lobe. In this case, the signals are congruent, and the brain assumes agency over the behavior. Now let's look at an example of a patient with damage to the AFMC. In this situation, as discussed before, the sensations and perceptions make their way along to the prefrontal cortex. But in this case, you'll notice an efference copy is not created due to the damage to the AFMC. So although movement and the subsequent afferent signal happen as normal, the parietal lobe doesn't anticipate the movement. At this point, the parietal lobe is thinking, why did my hand move? I didn't make it. This confusion in the parietal lobe explains the sense of agency lost in the alien hand syndrome, but it doesn't explain why the brain would approve some of the inappropriate behaviors characteristic of the disorder. To understand those behaviors, we will look now at a pair of inhibitory systems and how they can fail. So the AFMC also has the role of inhibiting reach and grab, or in other words, exploratory behaviors. There's another system in the temporal-parietal occipital junction that's responsible for inhibiting release or retract, or otherwise known as withdrawal behaviors. So let's look at how these two systems can fail and cause problems. So in this situation, this is again another normal activation situation. So we'll see that the AFMC, when it receives information, it can inhibit certain behaviors. Same with this temporal-parietal occipital premotor system here. That its job is to prevent or inhibit those behaviors from making their way into the prefrontal cortex to begin with. When the two systems decide a behavior is appropriate or desired, they let it pass into the prefrontal cortex and then out to the motor systems. As before, when all parts work, the parietal lobe receives matching afferent signals, creating a sense of agency. So before moving on, we have to distinguish between true agency and what's known as the sense of agency. So true agency is when the mechanism in your brain responsible for making decisions is undamaged. This means that all the actions you take are based on who you are and how you feel and how your brain actually goes through the process of deciding whether or not to do an action. That's all in place. The sense of agency is more related to your own cognitive perception of your agency. In other words, if your actions match the efference copy created from the AFMC, you'll feel a sense of agency regardless of the state of your decision-making abilities. So let's look at an example of this. Here, in this example, the patient's TPO system is damaged, premotor system is damaged, and it's unable to filter out withdrawal behaviors. So the unfiltered behaviors are then sent to the motor cortex, but also copied by the FMC and sent to the parietal lobe as an efference copy. So after the unwanted behaviors are still sent, they do create that matching efferent signal and send it to the parietal lobe. So the sense of agency is actually unaffected. These symptoms are sometimes used in the alien hand discussion, but they confuse the study of it as it results in more of the withdrawal features, where exploratory behaviors are by far the most common in the disorder. So this patient here is suffering from alien hand syndrome due to damage to the AFMC. While the TPO premotor cortex is still intact and inhibiting unwanted withdrawal behaviors, the AFMC damage allows exploratory behaviors to go unchecked. Also, notice that the AFMC doesn't send the efference copy as it should. So as we know now, it makes the patient feel they're not in control of their actions, which in this instance, they're actually right. So the final component of the disorder forces us to look at the way the hemispheres communicate intent to one another. The dominant hemisphere houses a majority of the conscious experience and relates to itself with access to language areas in its own hemisphere. The other hemisphere contains the agency mechanisms as previously discussed, but it receives a lot of influence from the dominant conscious side. So this is a quick diagram to show that relationship. We see the two agency centers housed in their respective hemispheres, with the dominant agent asserting a level of influence and control through the corpus callosum on the non-dominant side. This allows the dominant agent to kind of assert full control over behavior. But when the corpus callosum is damaged, then we start to see that the pathway of influence doesn't exist. So then the non-dominant agent is responsible for the entire hemisphere without ensuring it lines up with the intent of the dominant agent. This situation results in the most striking feature of the alien hand disorder, where one hand is fighting against the intent of the other hand. So because the disorder is so rare, there's so much to learn about it. While we're beginning to see some theoretical knowledge explain kind of the inner workings of this, research moving forward must begin to distinguish between unique features and behaviors as separate disorders entirely. Thank you.